At your first appointment, we'll talk about what's brought you to the appointment and why you are hoping to have a prescription issued for medicinal cannabis. So that will mean talking a little bit about your history, about the symptoms that you're experiencing, and also about treatments that you've tried in the past. We will then also talk about how medicinal cannabis is prescribed in the UK and go through that process with you. It's an opportunity for you to ask any questions. I think often people are really nervous when they come to their first appointment because they've been waiting for their appointment perhaps, and they really very much want to be considered for a trial of medicinal cannabis. So sometimes people feel really anxious. Please know that we know that, and that we are here to hear your story and to listen to you. Please feel free to ask any questions. No question is silly. It's absolutely, we want to make sure that you fully understand the process. In terms of what you need to bring, then usually we would ask to check some form of ID to make sure that we're speaking to the right person. And often beforehand, you may have already provided us with a summary of care from your GP or medical records. But if you want to jot down beforehand key points that you want to let us know, and I think often that can be really, really helpful because sometimes we forget those in the moment. So feel free to bring with you any old clinic letters or summaries that you think it would be helpful for us to know about at that time. The other thing that you might want to bring is physically a person who might be able to support you through the appointment, because sometimes people find that really, really helpful, particularly if they're feeling a bit anxious. And, you know, of course, you are very, very welcome to bring somebody with you. So the way we would choose the product is that we would think together about the main reasons that you are coming to see me. So perhaps, for example, that might be your sleep, or it might be anxiety in the day. And then we would try to match the best product from the formulary to treat those symptoms for you. And that might mean that you take one product for the day or one at night, or you might just be prescribed one thing to start with. And at the moment, what we're prescribing would either be an oil or it would be a flower, which you would be vaping. And sometimes, again, people will take a combination of the two, particularly perhaps for something like pain. So it's really very much around, we have a list, a formulary that we can prescribe from, and we will very carefully try to match the best choice for your particular mix of symptoms so that it's very unique and bespoke to you. And then we would start you on the treatment, and then it can be about thinking about timing of when you take these products, or dose as well, like with a more traditional medication perhaps. Obviously, people really want to get their prescription and get going with trying medicinal cannabis as soon as possible. So it's going to vary a little bit depending on which prescriber you see. But if I just talk you through in terms of the clinic that I'm based at, after we've had our meeting together, I would take your case and discuss it with a panel of doctors for it to be approved, to make sure that it fits the strict criteria we have at the moment in the UK about prescribing. And once that's been agreed, then I will physically write your prescription for you. The process is slightly different to getting a prescription from your GP, in that I write the prescription and then I will send it via a recorded delivery to a specialist pharmacy who will then prescribe the products for you. So once they have the physical prescription, they will call you and they will talk you through in terms of payment for the products, and then the products will be sent directly to you at home. So it doesn't, the big difference is it doesn't involve you having to go to a pharmacy at all. Now, obviously, because that process is slightly different, it can take a little bit longer. And we typically say to people that it's going to take 1 to 2 weeks from seeing me for the first time to physically getting your prescription. So then you just are aware of the fact that it's going to take a little bit longer. When you have your prescription, it will last a variable amount of time really for you, depending on how much you are prescribed and how much you're having to use. But for most of us as prescribers, we would aim to prescribe you for a month at a time. And then we know that you're not having any gaps, because we can plan when we issue the next prescription. Because obviously we want you to have a continued treatment. We don't want you to have any gaps at all. So typically your prescription, you would expect it to last you around a month. And your doctor would have thought that through with you and thinking about the dosage and making sure that you had enough to last you for the month. Once you have your prescription and you've started trialing your medicinal cannabis, then it's really important as part of your care that we see you on a regular basis for follow-up. And in our clinics, we would want to see you fairly frequently initially, want to make sure that you're finding it helpful, that you're not having any problems, and hopefully that you're coming back to us and saying, this is really helping me. So typically you would expect to be seen at least once a month in the clinic. And as part of the project, you would be seen every 3 months. Another way that we really track how things are going for you is through the questionnaires, some of which you will have filled in before your first appointment with the project, and those will be sent out to you again so that we can track how things are changing over time at your 3-month appointment for the project as well. And that's really helpful for us because it gives us really detailed, objective measure of, look, this was your score at the beginning and look at how much it's changed now. And I think that can also be really helpful for you because you can really see how things are changing over time. So follow-up is really, really important. Also, it's really important that we're liaising with perhaps anybody else involved in your care as well, particularly your GP, so that they know what's happening as well and they know that you're having regular follow-up. So at your follow-ups, we would be checking in how you're getting on with, say, the oil you've been prescribed. And sometimes people will be saying, I think it's not quite right, or it feels a bit too strong, or perhaps I have a few side effects. And then, of course, like we would with any other medication that you're being prescribed, we would think about, is that a dose-related thing, or do we need to change to a different product? So lots of people will swap between different products. That's absolutely not a problem. And it doesn't mean that you have to restart from scratch within the project. It will just be a case of having a different prescription issued for you. And it's actually really important for us in terms of our knowledge to understand why perhaps some people didn't like that product or didn't feel that it was helpful for them. So please don't worry about that. If you come back and you're wanting to change, that's absolutely something that you can discuss with whoever you're seeing. If you want to change clinics, that's also something not to worry about. It's something that does happen, and it may be because there's a particular doctor that you'd like to see, or you've moved, lots of different reasons, but all are fine. So in terms of the project, you would simply need to let the new clinic know that you'd already registered for the project, and then they can liaise with the project and ensure that all the data is transferred over. It doesn't mean that you need to restart from scratch. Everything that's already been captured and that you've already discussed will just be moved across so that your new clinic is aware of that. So again, please don't worry about that, but just let the new clinic know that you're already part of the scheme.